If there's anything COVID-19 has made people more aware of, it's their hygiene. Since the outbreak, most people are going the extra mile to be clean. But for people living with one subtype of obsessive compulsive disorder, the pandemic may be worsening their condition. In tonight's Finding Hope, our Frankie Catafaias tells us how COVID-19 is impacting treatments.
Imagine this. You've turned on your sink and start washing your hands. When you're done, you turn the sink off. But because you've touched your sink, you have to wash your hands again and again and again. The obsession to clean and the compulsion to continue cleaning with the sole hope of reducing distress are what mental health experts know as obsessive compulsive disorder's contamination subtype. This subtype, like many others, is commonly treated with a popular method known as exposure and response prevention.
Essentially what it means is we help people face their fears and do so without engaging in any type of unhealthy compulsion.
For those dealing with the OCD contamination subtype, this may include touching or tasting objects that would knowingly trigger a compulsion. But because of COVID-19, this form of treatment does not comply with the CDC's current guidelines.
This whole thing has kind of flipped the ideal treatment on its head.
But according to one licensed psychologist, people diagnosed with OCD or an anxiety disorder who have undergone or are undergoing treatment
are actually more resilient than the average person during this pandemic because they've gotten effective treatment.
We've been in a pandemic for 2 months now? I mean, have you noticed an increase in people obsessing about cleanliness and to the point where they've had to maybe seek a form of treatment?
It's really hard to say. People are feeling anxious during this pandemic, and that's okay.
Reminding you that just because you may have a desire to clean a lot doesn't mean you have OCD.
Obsessive compulsive disorder and anxiety disorders are debilitating. They're distressing.
It takes away a person's ability to live flexibly. It makes them very rigid in what they can and can't do.
Telehealth services are making access to treatment easy, but CDC guidelines are not making it efficient.
There's constantly new continuing education and webinars. Just how do we deal with this? Because it is so abnormal.
Frankie Catafaias, Idaho News 6.
Dr. Damon tells us an influx of OCD cases after the pandemic is unlikely.